lot of couples come to us asking as to when is the ideal time to try for conceiving. First thing we advise them is to not be very time specific. They have to be more natural when they are trying, because many a times the time frame that we tell them can cause anxiety in them, which is called as performance anxiety, where the man can have ejaculatory problems or erection problems, and the woman may feel a little lost during these times. But then again, since the ovulation happens only once a month, that is on the 14th day, we try to encourage them to have intercourse between 10th day to 18th day, and this is the most fertile period. The frequency at which they have to have sexual intercourse is at least once in 48 hours, that is once in 2 days, because the egg in the woman is alive for 24 hours and the sperms are alive for 48 hours. So if the intercourse happens at least once in 48 hours, there is a very high chance that the egg and the sperm can fertilize. As humans, the fertility is quite less, that is about 8 to 9%. That means if all the parameters are normal, if they are consistently trying, then the couple may have a chance of conceiving only about 8 to 9% in a month. That is, if 100 couples are trying, if everything is normal, then only 8 or 9 of them will conceive. So we ask them to do it consistently over the next period of around 9 months to 1 year. So if they do it consistently, then the chances of pregnancy is about 80 to 90%. And if they don't conceive at the end of 1 year, then we ask them to undergo a few investigations to find out as to what could be wrong. But many a times the couple come to us late, as in the woman will be older than 35 years, the man could be older than 40 years. Then the investigation can begin at least at the end of 6 months of trying, or even before that if the woman or a man has any other predisposing risk factors. So many a times they ask us as to how the intercourse has to happen. So there is no particular position in which they have to try, and sometimes we tell them that if they lie down at least for 10 minutes after the intercourse, this may slightly increase the chances of the sperm moving up into the fallopian tube to fertilize the egg. They ask us whether cleaning the vagina is advisable after the intercourse. That doesn't matter, but it has to be done only after 10 to 15 minutes. The sperms which are there in the vagina will take just about 5 minutes to reach the fallopian tube, where the egg will be waiting after ovulation for the fertilization to happen. So what happens after 15-20 minutes really doesn't change the chances of pregnancy. So with this fertility window or the fertility time frame that we give, does it really work? See, majority of the times it can work. Sometimes it may not work when the woman has irregular periods where ovulation cannot be predicted. It may happen, it may not happen in that cycle, and sometimes it can cause erection problems in the male partner. But trying it during this time, along with using the ovulation kits where you can predict the ovulation by just doing a simple urine test at home, can increase the success chance of natural conception if the sex happens during the time of ovulation. Thank you.